Number just came out 30 minutes ago showing a majority of people expect the cost of their health care to go up. National Business Group on Health finding 56% of American workers expect their premiums to increase. 32% think they won't get the same kind of coverage. 15% believe they'll be able to afford it anyway. Congressman Brad Wenstrup, a Republican out of Ohio, a member of the Republican Doctors Caucus. Louisiana Congressman John Fleming, Vice Chair of the Doctors Caucus, and Dr. Marc Siegel, professor of medicine at NYU and member of our Fox Medical A team here. Gentlemen, good day to all three of you. And Mark, we've talked about this almost daily, about the rollout and how things are going. But these members of Congress have been on and off with us over the past couple of months, trying to get us a sense about where they see this going. Brad Wenstrup, start. Well, based on what you have seen so far, what can Americans expect from this law that's now taking place?
Well, clearly what we're seeing is a difficulty in signing up. We're seeing that time and time again, and our constituents are responding to us in that manner, but they're also responding with their increases in premium. And it seems to be punishing healthy people more so than anyone else, and I've gotten notes to that degree from many, many people.
Now, why is that happening? Because we were told it was going to go the other way.
Yeah, well, someone's got to pay for this, right? And what's happening is they're making healthy people sign up, and whereas one constituent that I heard from said he had an $11,000 deductible, and his premium's going from $325 to $860 something a month.
That's ridiculous. That's three times.
Well, yes, that's exactly right.
John Fleming, how do you understand it as it's today?
Well, Bill, remember that this is a government takeover of 1/6 of the largest economy in the world. None of the people in charge of this have ever run a business. And so the terrible rollout that we see today is really a fever for the disease. The disease is this is an ill-conceived idea, an ill-conceived concept, and it's being poorly executed. So I would say to you today that this terrible rollout that's really an IT problem is really symptomatic of the future problems we're going to see, which is going to look like this, where you have in the exchanges sick people, older people rushing to the exchanges and healthy people standing back. That's called adverse selection, and that's going to put us into a cost spiral that implodes the system.
Sir, can they make it better?
It would be like making a skyscraper better that is built on a poor foundation, Bill. The whole thing needs to be taken down. We need to go back and reform health care once again on a bipartisan basis.
Okay, Marc Siegel now, weigh in on this. What are you hearing from your patients? Are they excited about it? Are they signing up? Are they? I imagine they're curious at a minimum.
Bill, I'm hearing exactly what that survey is saying today, which is most of the health care is employees get that over 160 million get it from their employer, and they're worried that if you start adding pre-existing conditions, no lifetime limits, paying for maternity care, paying for colonoscopies, that basically someone's going to have to pay for that, as Congressman Wenstrup said, and your premiums are going to have to rise no matter how many young people you add. And if you can't afford the premiums, you're going to end up on the state exchanges where we've talked about these glitches. On top of that, the networks are shrinking. The only way that you can control premiums is paying less per doctors. And the only way you can pay less to doctors is to take those poor doctors who can afford to work for almost nothing. And that means most of the best doctors are not going to work with Obamacare.
Right, but Mark, do you disagree with anything that was said right here? Or?
No, I don't disagree with it. I think that there's a big glitch. I think the exchanges were very poorly conceived, but I want to point out something that the congressmen have not said, which is the biggest problem is with the employer-based system, not with the exchanges, because the exchanges is 7 million people maximum, which they're not going to get, and the employer-based is 160 million.
To John Fleming and Brad Wenstrup, do either of you still see patients today?
I'll go first, if you will. I do see patients as a reservist at Walter Reed, so I still have my hands in practice.
What are they saying? What do they ask you about this? What do they want to know?
That's a different system at Walter Reed, of course, because we're taking care of our troops there, and so that's a different system altogether. But in general, as I talk amongst my partners that are still practicing, they're greatly concerned as to whether they're going to be able to take care of people properly. And we're looking at a situation right now where you have one of the largest business propositions that a country has ever had, but it's being run by people that have never run a business.
Yeah, 1/6 of the economy, right? John Fleming, do you see patients today?
I haven't been able to see them as often as I would like, Bill, but I received a letter just this week from a mother of an adult son who said that her son loved his employer health plan. He actually survived cancer and now is cancer-free. And now with the infliction of Obamacare, he's being forced from a full-time to a 20-hour-a-week job, and now he's got to go out and search for health care insurance.
I imagine these, some of these stories are anecdotal, certainly, but I think they tell us a bigger picture about what many people are going through right now. Mark, I asked John Fleming a moment ago, can they make it right? As we stand, or sit here today, rather, can they, and how would they?
Well, Phil, I think the biggest problem is they started by extending insurance rather than health care. And as both gentlemen just said, you can't get the access you need. You go to the doctor's office, you wait longer, you can't get in to see the doctor you want. He's no longer in the plan. She's no longer in the plan. The quality of care is going down. For them to make this better, they have to scale it back. They have to suspend the individual mandate for a year. They have to figure out how to deal with the doctor shortage. That should have been number one.
If you delay the mandate, does the whole thing fall apart, Mark?
I'm not concerned about that. Maybe so, but they have to do that. How can you mandate that people buy something that doesn't work for them? First step.
Brad?
Well, I think that Dr. Siegel touched on it pretty much right there. We are concerned more about getting patients into care. You have doctors in Congress that have been here since this conversation began that have never been asked for their input by the White House. And that is very integral to the fact that you are not talking to doctors that understand the situation. So that would be step number one.
I see. John Fleming, I'll give you the last word. As a physician, what should we understand?
I would tell you, as a physician and also a business owner, apart from my medical practice, that this system is set up to look like a market-based, risk-based insurance plan, but in fact it's a wealth redistribution, and you will see that play out over the coming months and years.
John Fleming, thank you for your time. Brad, thanks to you as well. Brad Wenstrup and Dr. Marc Siegel.
Thanks,
Thank you, gentlemen. 22 before the hour.